evening, ladies and gentlemen. A very warm welcome to another live episode of Sensory Planet. Today, we have a very special guest with us. His name is Dr. Frederick Covington. He is a Howard graduate and he's an award winning occupational therapist. I'm so excited to have him here today. So, without wasting any time, let's welcome him and he will be introducing himself to you. So, here we go.
Hello, everyone. My name is Dr. Frederick V. Covington, and I'm an occupational therapist here in the U.S. in Washington, D.C. Thank you for having me.
Well, thank you so much for your precious time. And me, myself, and I'm sure all the viewers are very grateful. Okay, so I want you to, briefly introduce your experience, your education, your academic life, and all the things to the viewers. And I would also like you to briefly define occupational therapist for the viewers who are not related to this field, because this is such a wide field that it is sometimes difficult even for the occupational therapist. So some of it in the few words. So over to you.
All right. Well, again, my name is Dr. Covington. I am an occupational therapist concentrating mostly in pediatrics in the Washington, D.C. area. I started off going to school at Howard University, and I obtained my bachelor's at Howard University, and I went on to further my education to obtain my doctoral degree in occupational therapy. When I initially started in occupational therapy, I started in the group home and geriatric population. And as I was trying to find my niche, I found myself being more pleased working in the pediatric realm. Currently, I'm a professor at Howard University, the school that I actually attended. Um, I am also the host of various shows in regards to occupational therapy. And that one is Occupational Therapy Insights, which is also an app and a podcast, which I attempt to spread the word of occupational therapy and to also assist those in occupational therapy with items that they may not have, such as evaluations, study guides, and things of the sort that would be beneficial to those of us in occupational therapy. Also, I am an inventor. I've invented what's called the Right handwriting protocol, as well as virtual reality occupational therapy, which I use both of those with my clients in my clinic in the US. Now, to give a definition of occupational therapy, I think it's best to keep it very simple. To me, occupational therapy, if I had to define it to a wide audience that doesn't only include occupational therapists, OT basically helps you be you. And when I say that, it helps you do your occupations, whatever that occupation is for whomever you are. Whether it's a child in school that needs to improve on their writing, or executive functional kids, whether it's a mother who recently has, for instance, had a stroke and is going through rehabilitation to be able to continue her role as a mother, or for a worker who's been injured on the job, who's seeing occupational therapy in order to regain his maximal physical function and to get back to work, or even to someone that was born with a disability or with special needs, and we need to adapt their environment in order for them to fully participate in the life that they want to live. And so that's how I would
Well,
define
yeah,
occupation.
that's beautifully summed up by you, I must say. Okay, so, I was reading the bio, and I would like you to define that how would you define the holistic patient care, when you say that treat the person and not the diagnosis, what exactly does it mean? Because I'm sure most of the therapists or the doctors must be looking forward to treat, the diagnosis might be. So, how would you define it that treat the individual and not the diagnosis?
When I say treat the person and not the diagnosis, I mean that very, very literally. I think in the world of health professionals, be it OT, medical doctors, physical therapy, speech pathologists, what have you, we will pick up a chart and we'll look and we'll see the diagnosis. And so our wheels start turning then. Well, I need to do A, B, and C for this particular diagnosis. And I think a bad thing is if we get into that habit of just thinking of that same pattern with the diagnosis that we encounter. We encounter cerebral palsy. We cannot always do just A, B, and C for case one, A, B, and C for case two, A, B, and C for case three. We have to look at that particular person and how they are living their lives. It could be, like we were saying earlier, it could be a 4-year-old child with CP as opposed to a 17-year-old with CP. We can't take the same approach because they have two different places in life and they're trying to accomplish their different occupations at that point in their lives. So that's why I like to concentrate on treat the person and not the diagnosis so we can make our treatment client centered and not diagnosis centered.
All right, so in some of the institutions, there are monotonous assessment forms, made it as an initial assessment form, initial and formal assessment form that they must be full out while, assessing every patient. And well, it works in other fields like psychology or speech therapy and physiotherapy. Maybe it works in other fields. But do you think that same works for an occupational therapist? Do you feel that no, the monotonous assessment form or one single one page or two page assessment form or the treatment plan, that we usually fill out, doesn't work? And if it doesn't work, then what should be the way of an occupational therapist of assessing, the clients and making the treatment plans?
That's a very good question. And when I initially started in occupational therapy, this is something that came up because I was doing the same thing for every single client. Whether you came into the clinic and you were 10 or you came into the clinic and you were 60, it was the same assessment. So for me, what I did, and I think would be beneficial for all occupational therapists, is to what I do, I simply interview the person first. I don't speak about anything medical. I don't talk about their functional status. I don't talk about any limitations they have. I simply talk to the person. Now, after that, then I will go to the standardized assessment, and that's merely to um, gather information we need, like range of motion, muscle strength, visual perceptual skills, things that I'm going to use secondary from getting to know that person. And now the third step, I'm tying in that initial interview with the standard formal assessment to come up with my treatment plan for that particular person. Mhm.
All right, very well. So, if we talk about the pediatrics occupational therapist, and in the pediatrics, if we particularly talk about autism spectrum disorder, we know that, especially in autism, every child or every person is very much different to another. In a same diagnosis, autism spectrum, the two person cannot be similar. This quite of sometimes raise the expectations of the parents and the caregivers. They compare their child with the progress of another child, and sometimes it also strain the parents therapist relationship. In this regard, how would you what suggestions would you give to the parents about what to expect, and what suggestion would you give to the therapist that how do they counsel the parents, regarding making these comparison and the progress and giving predictions.
Well, for the therapist, just like you were alluding to, when you meet one person with autism or that has an autism diagnosis, you meet one person with autism. Their particular case and how they present has no bearing whatsoever on all the other clients you may see with that ASD diagnosis. Um, for parents to not let them, let's say, raise their expectations too high because they're comparing it to another child they may have been referred to our clinic with or may have seen on some TV special. I think that initial interview kind of that kind of gives parents a realistic view of what's going to happen with their child, because having that initial interview where I sit down and I talk with the parents about their particular child and not what I'm doing with child A and what I'm doing with child B, I think it establishes what is specifically going to happen with their child and how we're going to progress and what plans we're going to make specifically for their child and their family. So I think that brings everything into a realistic perspective for parents, and it doesn't allow the client occupational therapy relationship to be strained. And another thing is, I am always I'm always hopeful, but I try to be as truthful and straightforward as possible. And I think we as occupational therapists, we need to learn to be able to express this in a non-medical way. Just like if we're talking to one of our family members, we're not using our occupational therapy jargon. We're not saying neurological this or range of motion that or sensory integration this. We just have to talk to them as we would talk to, say, just a member of our family that's not medically aware of our medical jargon.
Well, that's very well. Okay, so before we move forward, we have a live question from Tawsif Alauddin, and she's saying, "Hi, I'm a special education teacher. I would like to know that how do you judge whether a child is left-handed or right-handed, as she holds the pencil comfortably in both the hands, so it gets a bit tricky to well define it."
Well, for me, what I do, I let the child take the lead. I don't push one hand or the other. But what I do, I observe what they do um, throughout the day. Even if I have to follow that child, let's say if we're in a school setting, I follow that child for a couple of periods throughout the day. I watch how they interact with their friends. I watch, especially if it's lunchtime, how they eat, what hand they prefer, because usually what hand they prefer when they're eating, that's going to be the hand that they're going to be writing with. I watch the hand that, even simple tasks. How do they open the bathroom door or the bathroom stall? And how do they reach for things? If I'm handing them something, do they reach for their left hand? Do they reach for their right hand? So you kind of have to pick up on the clues and let that child lead you.
All right, that's very well. Okay, so talking about the handwriting issues, and now